Some viewers may find the following video disturbing. Viewer discretion is advised.
Welcome everyone. Today we're going to be talking about Dr. D Part 2. This is the story of Christopher Dunst. When we last left off, we had talked about Christopher Dunst's upbringing and his education, not only in high school but in college. And as I'd said before, he had completely relocated from his home in Memphis, Tennessee, and would take his girlfriend, Miss Young, over to Dallas, where he would get a job at Baylor Plano as a neurosurgeon. It has been said that he, in his education, would switch to neurosurgery because he found it to be a lucrative business. And being that he was in debt $500,000 and they were offering at least $600,000, he could get himself out of debt, and he found it to be, as he said before, a lucrative business. Baylor Plano, unfortunately, would soon realize just how problematic Christopher Dunst would be. It is said that on one occasion that he had performed a surgery and they had requested that he spend 3 days being with this patient to make sure that they turned out all right, etc. But instead of actually spending time with his patient and making sure that everything turned out all right, Christopher Dunst would actually completely refuse to even look after the patient, would actually take 3 days in a vacation over in Las Vegas. Christopher Dunst's first patient at Plano would actually be Kenneth Fennell. And Fennell would actually go into Baylor complaining about some problems with his back, to where they would direct him to their neurosurgeon, Christopher Dunst, and he would take him into surgery. Dunst would actually operate on his back, but actually operate on the complete opposite part of his back that was the actual problem. And when he woke up, he would have chronic pain and debilitating pain in his lower and upper portions of his back, to where he would go to Dunst again for another surgery, and Dunst would take a second surgery to fix the problem from the first surgery. But instead of fixing the problem, it would actually leave him partially paralyzed, to where he could only walk with a cane and spend most of his days in a wheelchair. It has also been said that during times that he could actually stand or walk, he could only stand or walk at 30 minutes at a time without having to sit down and get back into a wheelchair. Medical investigator Lee Passmore would actually approach Christopher Dunst for a surgery himself. He was having back problems due to his job, and Dunst would then perform a surgery on him as well. During this surgery, he again would botch the surgery. He would cut a part of his back that wasn't normally touched during the time of those procedures, and he would misplace hardware in his spine. He would also sit there and put a screw in the wrong part of his back during the procedure, and would also strip the screw so that it couldn't be replaced. It was also put in a way so badly that if it was taken out, he would actually bleed out. Vascular surgeon Mark Hoyle would actually assist with the operation, and would later recall about him being completely oblivious to certain bleeding in the surgery. He would actually be so pushed far during the surgery that he would physically restrain Dunst from the surgery, as far as basically putting his hands over the surgery operating kit and literally telling him, "You're not doing this." He would actually restrain him to the point and literally tell him to his face that you're dangerous. In a later interview, Hoyle would actually make the statement that he often wondered about Christopher Dunst's sanity. Barry Morgoff would be his next patient, or I should say victim. He would come to the aid of Christopher Dunst when he had pulled a muscle in his back. He worked at a pool company for his father, and when he was unloading a truck, he had actually pulled this muscle in his back, so he would go to Christopher Dunst for an operation to kind of help with the back pain that he was having. Christopher Dunst would again botch that surgery really badly and leave him with a lot of long-lasting effects. It is also said that during the operation room that he would pull a disc out of his back using a grabbing tool, which you never use during those kind of operations. People would say that he should have used a scalpel to remove the disc, but instead he would just take this grabbing tool and yank it out, which caused a lot of long-lasting effects. Barry would often go to Christopher Dunst for medication to alleviate the pain that he was dealing with, but he would refuse to give him any medications, claiming that Barry was nothing more than a drug seeker. Might I also add, this is coming from the doctor that would come in every day high off of cocaine. Barry would go to a follow-up with Christopher Dunst and then immediately walk out when he had seen that Christopher Dunst had shown clear signs of being inebriated. Jerry Summers, which is one of Christopher Dunst's longtime friends during college, would actually go to Christopher Dunst for a surgery for a fusion of the two neck vertebrae. And Christopher Dunst, again, would botch that surgery. And he would botch this surgery so badly that it would leave Jerry Summers a quadriplegic. When he awoke from the surgery, Christopher Dunst refused to even check on him or even see how his friend was doing. To the point that Jerry Summers pulled a nurse aside and made claims that the night before that they went and had the surgery, that him and Christopher had spent the night taking cocaine all night together. They would actually call Christopher Dunst in to do a drug screening to make sure that what he was saying was not true. And Jerry Summers would later recant his statement, saying that he didn't really do cocaine with him the night before the surgery. He just made the story up because it hurt him, that the fact that his doctor wouldn't even check on him, and even his friend wouldn't even check to make sure he was okay. During the surgery, an anesthesiologist would say that he had lost almost 1,200 millimeters of blood during the surgery, which is completely not normal. Summers would actually remain a quadriplegic for the rest of his life until he had gotten an infection in 2021 where he would ultimately die. This is an infection that would mainly be caused by complications caused by the botched surgery of Christopher Dunst. During the holidays of that year, Kelly Martin would actually come to Baylor to seek Christopher Dunst's attention because she, during the holidays, was trying to put the tree and everything down after the family that came and seen them. And she would fall off a ladder and mess up her back. So she would actually go to Christopher Dunst to help with the back pain. And might I also add, she was doing this before going to a family cruise that her family had been saving up for. At the meeting with Christopher Dunst, she was very concerned about the surgery and asked how successful the surgery rate was, to which Christopher Dunst would tell her that it was a very basic operation and more or less compared it to getting your wisdom teeth pulled out. She would then also ask if he had ever had any failures or deaths under the operating table, to which Dunst would look at her and knock on his desk and go, "None, knock on wood." To say that Dunst completely botched this surgery is a complete understatement. Dunst would actually cut through the spinal cord and actually sever an artery. And even after doing that, continued operating, disregarding the fact that Kelly was losing a large amount of blood. People would later testify and say that during the operation, she had lost so much blood that the blue blanket that they put over a patient during surgery was completely soaked in blood. They said there was so much blood loss on the floor that they had to soak up all the blood with a towel. He would even refuse that anything was wrong and everything was fine, completely hindering the ICU from trying to save her life. When she awoke from the surgery, she would wake up screaming, clawing at her legs, to where the ICU team would have to re-anesthetic her and put her to sleep. Might I add, during this time, Christopher was taking notes in an office instead of tending to his patient. This death would actually be the final straw for Baylor Plano and would actually permanently suspend his surgical privileges. They would try to do a review of Christopher Dunst, but he would resign at that point in time and move to a different hospital. And because he had resigned instead of getting fired, they didn't contact the National Practitioner Database. which looking back Baylor should have done from day one.